Welcome to Adapting Class. Nursing students ready for Maternity NCLEX Questions. These are all OB, emergency, labor, and delivery. Focusing on what? Select or apply. Every question is a select or apply so that you can master SATA. I have 10 questions, high yield, labor and delivery complication to make you comfortable. Let's get to it. First question. A client at 34 weeks gestation report a sudden gush of fluid. Contraction occur every 5 minutes. Fetal heart rate is 150 beats per minute with moderate variability, which nursing action are appropriate. Select or apply. Monitor maternal temperature every 8 hours. Continuous fetal heart rate monitoring. Perform a digital cervical examination. Prepare for immediate delivery. Administer Pitocin immediately. This is a new generation. Select or apply. You don't have to pick everything. Pick those that you're confident. In this new generation, if you know one, pick it. If you overselect, you lose point. If there's 5 answer choice there and you pick 2, you get 2. If there's 5 answer choice there and you pick 6, you're going to lose 1 point. Therefore, pick those that you're confident. If you pick one, you got it. Now let's look at the question. That's the strategy to answer select or apply. Now, I want you to put down your answer in the comment. Let me know which answer choice you pick. It's a select or apply, so you don't have to pick everything. But I'm going to break it down for you. Like I said, select or apply. Pick those you're confident. There's an action there. Nurse has to do something. About what? 34 weeks. Preterm, right? Gestation has sudden gush of what? Fluid. Something is wrong. That's amniotic fluid, right? Contraction every 5 minutes. Look like she's in labor. Fetal heart rate is what? 150. The baby is okay with moderate variability. What would you do? Do you monitor for maternal temperature every 8 hours? Do you continuous fetal heart rate monitoring? Do you perform digital cervical examination? Do you prepare for immediate delivery? Or you give the patient Pitocin? The key concept is what? Preterm and the rupture of memory. Number one thing you should worry about when they rupture their memory is what? This is the concept. I want you to write it down. It's going to be in yellow. Preterm premature rupture of memory. The first thing you look for is what? Infection. Every question, I'm going to give you one concept. Write it down. When you hear this preterm, because it's 34 weeks, premature of rupture memory, she's not due yet. First thing you look for is infection. How do you monitor for infection? Every 8 hours is too long. You got to do it better. And if there's infection, we give them antibiotic and then we prepare for delivery. If there's not, then we got to slow mommy down. There's nothing in the question telling you that there's infection. So what we're going to do is going to monitor for temperature, but this is too long, 8 hours. We're going to continue to monitor the fetal heart rate to make sure there's no deceleration, because when the water comes up, we're going to have probability of cord prolapse. Baby is going to have bradycardia. Therefore, fetal heart monitoring is okay. We're not going to put our finger there because then there's going to be infection. We can look and see if there's a cord prolapse. No need to perform digital examination at this time. We can look and see if there's a cord prolapse. Prepare for immediate delivery. Like I said, 34 weeks, we're not ready to delivery. We can slow the mommy down for now. Administer what? Pitocin is going to cause immediate delivery. This is our concept. Fetal heart rate is 150. The baby is doing okay. There's moderate variability. Baby is doing okay. There's no fetal distress. Fetal distress will happen if there's infection. This is the way all the questions is going to be. Therefore, what do you think is the right answer? There's only one answer choice there. All the answer choices are wrong. If you pick more than one, you get 0 for this. There's only one question. I intentionally set this one as number 1 to let you know, SATA for the NCLEX, you have to be careful. Select all that apply. That don't mean you got to pick all again. Just pick those you know you're 100% confident. So one answer choice is fine. Which assessments are appropriate to confirm rupture of the memory? Select or apply. A nurse is caring for a laboring client who report a sudden gush of clear fluid from the vagina. SATA question. Don't pick everything. What is the concept? Go for the buzzword. Sudden gush of clear fluid from the vagina. rupture of the memory. How do you confirm it? Test for vaginal fluid with nitrazine paper, assess fluid for finding under the microscope, perform a routine digital vaginal examination, assess the color and the odor of the fluid, obtain fetal heart rate tracing. All the answer choices, all the questions follow the same concept. Select or apply. I need to confirm. That's my birth rate. I have a gush of fluid. Rewrite it, and it said rupture of the memory. I need to check if this is amniotic fluid. And if this is amniotic fluid, what is the baby doing? That's all. Put down your answer in the comments and let me know. I'll give you a few seconds. Think about it. Lock in your answer choice. But guys, the right answer, I'm going to break all of them down. But the key concept is this. When there's a rupture of the memory, if you examine that, it's going to cause infection. You can check for cord prolapse. You can confirm amniotic fluid by using something we call nitrazine paper. Or if you don't have it, you look at it under the microscope, called finding. The amniotic fluid will find like a fingers in a microscope. Once again, no digital rectal exam. So 3 is wrong. Assessed the odor and the color of what? The fluid. This will tell you if this is true amniotic fluid. It's clear liquid, it's clear, and you're going to see what, if there's a meconium, you can see that, oh, this is coming from amniotic fluid. And since it's going to affect the fetus, you need to check for fetal heart rate because it's going to have bradycardia. Every time there's a gush of fluid, check for bradycardia. Every time there's a gush of fluid, check for bradycardia. Which intervention should the nurse anticipate? Select or apply. I'm taking you to what? The next generation questions in a table form. Why do I do that? It's the same thing. Select or apply. Take away the table. You see, there's no table, but the table will come. Assume it like there's no table. And what is the question? A client with prolonged rupture of memory and has GBS positive and develop fever, bad combination. And this is what you have. It's the same thing. Don't worry about it. I put intervention, anticipate, don't anticipate, select. It's the same. What do you think will happen? Assume there's no table. Just ignore the table and analyze it. Do you give antibiotic? Do you monitor for fetal heart rate for bradycardia? We talk about it. Do you give the mommy magnesium sulfate for neuroprotective? Do you prepare for possible expedited delivery or give them terbutaline? Lock in your answer choice and let me know in the comment section. But this is the way we're going to break down the question. If I'm taking it, is the way. I said, there's a client, I don't know how old, weeks, mommy is, but there's a prolonged, tell me it's more than 18 hours, long time. There's a risk of infection, memory has ruptured, and there's a evidence, there's a GBS positivity. We have a problem. Baby, mommy has fever. We have infection. We worry about chorion amnitis. This is deadly, sepsis for the baby. What intervention we should do? Write it down. When there is infection and baby is possibly likely to be infected, it does not matter how old is the baby, we're going to deliver it because the infection is a problem. You can't keep your chorion amnitis inside the mommy's room. Baby is not going to survive. Therefore, what do you think we're going to do in this situation? Prophylactic antibiotic is good. We're going to monitor baby heart rate, but look at the situation. This is more like infection process rather than fluid being lost right away. Look at the question. Prolonged rupture of memory. That means he has ruptured a long time ago. So now we worry more about infection, right? Infection. What will indicate infection? Fetal bradycardia is associated with rupture of memory right away. What is going to be worrisome is tachycardia, not bradycardia. So that's wrong. That's a trap. We're not going to stop contraction. Therefore, that's wrong. And then we'll be ready to deliver the mommy because of the infection. So that's right. Prepare for, and we're not going to give them terbutaline because of what? We want to deliver the baby right away. And therefore, no magnesium, no terbutaline, You're going to check for tachycardia, no bradycardia, give mommy antibiotic, and then we deliver the baby. That's the concept you should focus on. Which prescription should the nurse anticipate? Select all that apply. What are we going to do? A nurse is caring for a client who is at what? 28 weeks gestation with confirmed premature rupture of memory. She ruptured of memory, she's 28 weeks. What do we have? Do we give the mommy steroid, Pitocin? Do we give the mommy misoprostol, prophylactic antibiotic, start the tocolytic, and perform amniotomy? Concept, 28 weeks. What do you think? Put down your answer in the comment. Lock in your answer right now before I give you the explanation. That's how you benefit from this OB maternity nursing NCLEX practice question, NCLEX review question on labor and delivery emergencies. What do you think? Key concept. This is the way I will analyze the question. And if you're analyzing, be careful. 28 weeks preterm, and we have confirmed rupture of memory. So preterm rupture of memory, right? And it's prolonged, premature, right? Prolonged rupture of memory or premature rupture of memory. That's the problem we have. Which prescription should the nurse anticipate? Select or apply. She's 28 weeks. We worry, right? We got to prepare and make sure we allow the fetal maturity of the lung. Steroid is good. Pitocin is not good. It's going to cause contraction. We're going to deliver the baby 28 weeks. It's not, because there's no confirmed infection. Don't make it up. Don't make it up. I have to tell you there's infection or give you something in the question before you proceed. Misoprostol is going to deliver the baby. We don't like it. Antibiotic will prevent infection. Tocolytic will slow it down. Amniotomy, well, we're not going to cut you anymore. You already ruptured your memory. So this is not. These are some of the things you see. It's there to trap you, but it makes you think. Stay with the program, I call it. Stay with your gut and know that this is what I know. I'm not picking you. Therefore, give steroid for fetal maturity of the lung. We're not going to give Pitocin because 28 weeks. We're going to give antibiotic to prevent infection. And then we're not going to give the mommy misoprostol, causes contraction. We don't want contraction. Amniotomy will cause contraction, but we already had amniotomy. Therefore, why do we want to do that? Negative. You see, 4 questions. What is your score so far? What is your score? Let me know. What do you think? Number 5, same concept, right? Which nursing action are appropriate? Select or apply. Don't over-select. Just go for the buzzword, put it together, then come up with the concept. Use the concept to look at the answer. A client at 39 weeks, that's a clue. Present with what? Spontaneous rupture of memory, like she ruptured normally. Amniotic fluid is normal. There's no signs of infection there. What action would you take? Do you check for fetal heart rate? Do you check for the color that is coming out, the amount, and the how it smells? Do you perform examination, digital cervical examination? Do you monitor for signs of cord prolapse? Or you document the time of the rupture of the memory? What do you think? Lock in your answers. But this is the breakdown. This is the explanation, and this is the rationale. I could give you rationale, then give you the answers. Of course, we have a rupture of memory, and amniotic fluid is clear. I'm worried that there will be cord prolapse. I got to check if there's a signs of infection. If there's signs of infection, I'm going to deliver the baby. When there is a rupture of memory, cord prolapse will lead to fetal heart rate deceleration. I'm going to check for you. I got to assess the color. If there's a meconium, I'm worried about respiration or other signs of infection. If I put my finger there, it's going to get infected. I can see what is going on. I can monitor for signs of what? Cord prolapse, because I can see it. Document the time of memory rupture so that I can know whether it's a prolonged problem. You see, you know the answers, focus on the buzzword. And when you focus on the buzzword, it becomes easy. Spontaneous rupture of memory, what are the concepts? check for fetal heart rate, know the time, know the quality, the amount, and of course, fetal cord prolapse. And those are your right answers. You can see number 1, number 2, number 3, and number 4 are your right answer. Cervical examination will cause infection. And this is assessing a postpartum client 24 hours after delivery. She just delivered 24 hours, which finding indicate normal uterine involution. Try to go for the words in the question. I call it buzzword. Select or that apply. Fundus, the fundus firm and midline. The fundus are slightly below the umbilicus. Lochia rubia with that large clot. Boggy fundus deviated to the right. Saturating one pad per 15 minutes. Which one is associated with uterine involution? Sometimes you may see words and you think it's hard, but I want you to lock in your answer so that I can break down the question for you and the answers and we can figure it out. First, select or apply. Tell yourself, don't over-select. Which finding indicate what? Buzzword, uterine involution. What is that? It means contraction. Means the uterus is going to be going the pathway it's supposed to. It's not going to get bigger. After delivery, it starts to get smaller, smaller, smaller. It's been 24 hours. What indicates it's getting smaller? When it's smaller, it's going to get firm because it's contracted. It's going to be midline. It's going to go down in the middle. It can be below the umbilicus. 24 hours is fine. It's supposed to be below. It's not above it. The cloacia, of course, there's going to be lubia, but this one is a no large clot. Okay. If the fundus is firm and midline, it can be boggy and deviated. Therefore, this is wrong. If you're saturating peripad every 15 minutes, I'm worried about it. It means you're bleeding. That is not normal. Normal evolution, the normal involution does not cause peripad saturation within 15 minutes. That's too much. If it's hour, yeah. Therefore, what are your right? 1, 2, and 3 are your right answers. 4 and 5 are bad. Number 7, almost done. And it's assist with what? Amniotomy. It means we broke your water spontaneously, artificially. Spontaneous, you do it. Artificially, we did it. Which action added a priority immediately after the procedure? Select or apply. SATA NCLEX question. NCLEX practice question using SATA on maternity, nursing, labor, and delivery. That is the concept with complications associated with it. Know them. These are things that shows up, but be comfortable with the select or apply. Assess for fetal heart rate, monitor for uterine rupture, assess uterine contraction pattern, place client in high Fowler position, and prepare for amnio infusion. Some of these questions may trap you, say, oh, what is so many SATA? Look, it's not. Ignore the number of answer choice and identify each question, each answer as single. If you use your buzzword, what are you going to select? Lock in your answer. And let's get to the content. Amniotomy, I break your water. Therefore, something is going to happen. You're going to lose all the water. What priority? Well, if I break your water, there will be infection, right? If I break the water, you're going to lose the water. Problem of cord prolapse. If there's a cord prolapse, baby heart rate will drop. Assess for fetal heart rate. I'm not going to monitor for uterine rupture. Just because you see it, you think I got to pick it. No, I said cord prolapse for amniotomy. Doing amniotomy does not rupture the uterus. I got to look at contraction. When you lose the water, your uterus contraction may change. So look for the pattern of contraction. And how do you place the mommy? You want to place them so that there's no cord prolapse. At the same time, you want to support their airway. High Fowler position is too much. It causes problem. There's less blood flow. Therefore, semi-Fowler is the best thing. Or supine. The best is supine with the head elevated. You can put somebody in supine and still the head of the bed elevated like that. They lay down like that. Or you can put it in the supine. But that's the best position you can put them. Which one you will select in the test? I will put semi-Fowler. Know that semi-Fowler position, not high Fowler position. Don't pick high Fowler. Amnio infusion. Well, there's a reason why I did amniotomy, to get rid of the fluid. Why would I put more fluid there? I'm not going to do that. Therefore, this is wrong. So what are your answer choice? These are the concept. Break it down first. Break the back down. You're going to lay her back, listen to the baby, and check for cord prolapse. Though check for what? Fetal heart. We're not going to monitor for uterine rupture. We're going to look at for contraction. We're going to place her in the semi-final position, and we're not going to do amnio infusion. That is the key. Which finding supports the suspicion? Select or apply. What am I suspicious of? And then suspect the uterine rupture in the laboring client. Therefore, which one is consistent with that? Don't make it hard. It means uterine rupture. What is the signs of a uterine rupture? That's all. What do you think? Sudden onset of fetal heart rate deceleration, loss of fetal contraction, progressive cervical dilation, sudden severe abdominal pain, maternal hypertension, and loss of fetal station. These are features, diagnosis. You can put this in the case form, and that will tell you whether mommy has a rupture or no. Lock in your answer. But this is the way the answer should be. When you rupture your uterus, there is going to be a sudden deceleration for the baby because the baby is not going to be happy. Bradycardia. There is not going to be any more cervical dilation because the mommy is not contracting. You're going to have severe abdominal pain after uterine rupture. Mommy is going to be hypotensive because of bleeding, not hypertension. The fetus is going to lose its station. If they are almost about to be delivered, they're going to go up. So there's loss of fetal station. And contraction is going to stop. These are classic signs and symptoms for what? Uterine rupture. Write it down. That's the concept. So when you see it in the case form, these signs of uterine rupture. Which intervention are appropriate about what? And then suspect uterine rupture in the laboring client. Therefore, what do? You know the signs of uterine rupture. What next should you do? This is an emergency. Do you put mommy in the knee to chest position? You give them oxygen via nasal cannula? Do you insert 2 large bore IV 25 gauge? Do you notify the healthcare provider? Do you activate emergency response system or prepare for C-section? Concept. You rupture your what? Uterus. Baby has lost station. You are hypotensive. No contraction. What do you want to do? The buzzword is uterine rupture. What do you want to do? You know when you rupture your memory, the baby fetal station is lost. Mommy is going to lose some blood, abdominal pain, and then everybody is sick, including the mommy. What position will you place somebody in the who is hypotensive? What do you think? Knee to chest position? No, you're not going to put that mommy in the knee to chest position. Oxygen delivery via nasal cannula, they will need high flow oxygen. Insert 225 gauge is too small. Do you notify the healthcare provider? Yes. Do you activate emergency response system? Yes. Do you prepare for C-section? Of course. Therefore, what do? 25 gauge, even though it's 2, it's not. You need 18 gauge, 16 gauge. A lot of blood is lost. We have to notify the provider. Nasal cannula, no, high flow oxygen. We got to prepare for C-section. We got to respond and activate everybody to come in. And then we put a mommy on where position. If you are hypotensive, left lateral position, no need to chest position. So this is what we do in uterine rupture. I'm using the concept to answer the question. There is not something you don't know. You know it. When they put it in this form, you have to think critically. Just don't let them trap you and think about the situation and pick the answer that you have. Last one. This one is a little bit hard if you can't recognize it. If you don't know the diagnosis, I did not put the diagnosis there, but I'll give you information that you can use things in the question to answer the question. A client suddenly developed respiratory distress. 1, hypotension. 2, bleeding during labor. 3 things are happening. Which nursing action are appropriate? Select or apply. Do you activate emergency response system? Do you prepare for blood product administration? Do you place the client in the supine with the leg up? Do you obtain informed consent for procedure? Do you prepare for CPR? Do you give the patient high flow oxygen and transfer? This is designed to help you answer a question that you don't know what it is, but there's things in the question that is bad. The easy way to answer the question is to know what is the problem. Patient is laboring. Before that, I want you to put down your answer choice. It's a select or apply. Don't over-select. Pick those you're confident. There's 7 answers there. You don't have to pick all 7. Don't be greedy. If you know only 5, pick it and move away. You have 5 answer choice. If you pick 6 and there's only 5, you lose 1, right? So pick those you're confident. So what is the problem? Lock down your answer. Put it down in the comment and say hashtag number 10. This is what I selected. But it's a select or apply. Actions I need to take. Respiratory distress, well, airway. I got to do something about airway. Hypotension. I got to do something about hypotension. Bleeding. I got to do something about bleeding. What is the problem? A laboring client. If you are in labor, what is the key things happening? Any mommy who is in labor and they have all these signs, respiratory distress, hypotension, and bleeding, we call it amniotic fluid embolism. This is amniotic fluid embolism. And what is the concept about amniotic fluid embolism? It's all about the mommy. Don't worry about the baby because mommy is going to die. So everything is about mommy. We're not delivering the baby unless we can see the baby crowning is right there. Otherwise, we ignore the baby completely. Labor is going to stop. And we're going to call people to come and help us. So activate emergency response system. We have amniotic fluid going to the blood and then going to the mommy lung. It can lead to cardiovascular collapse and can lead to DIC. This is a bad problem. So activate emergency system. Have blood product available because of DIC. You don't want to place the patient supine, leg elevated in the hypotensive patient? No, in the left lateral position. Do you need informed consent? It's an emergency. We don't need informed consent. We need to do things right now to save the mommy. They may have cardiovascular collapse and they may need CPR. High flow oxygen, and we got to transfer them to the ICU. Once again, we got to stop labor. Unless you can see the baby is right there out, we ignore everything and save the mommy. Otherwise, mommy is going to die. So activate emergency response system. Prepare to give blood product due to DIC. Prepare for CPR. Give them oxygen and transfer them to the ICU. 10 I-heard NCLEX practice question on maternity, nursing, labor and delivery using select or apply and prioritization to know the concept. This is maternity nursing practice question. Thank you for watching labor and delivery. And I know if this helps you, your content regarding labor and delivery, put down hashtag labor and delivery mastered in the comment section. Thank you very much and good luck in your exams.